Congressman Waxman, thank you so much. It's a pleasure and an honor for all of us in the city of Calabasas to have you here. And we want to thank the Chamber of Commerce for organizing this meeting. And welcome to our City Hall and to our city. And thank you so much for all your incredible service. What is this? 38 years in Congress. And will go down in history as one of the great members of Congress, particularly on health care issues. So it's an honor and privilege to have you here. I have two of my colleagues from the City Council here today. Our Mayor Pro Tem, David Shapiro, is here. You can applaud for the Mayor Pro Tem. And Councilwoman Lucy Martin is here. And with that, I'd like to turn it over to the Chamber to Michael Higginbotham, who's going to lead the introductions. Thank you again.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor. Again, my name is Mike Higginbotham. I'm on the Board of Directors. I'm Vice Chair of Government Affairs, and I want to welcome you here this morning. Thank you. First of all, I'd like to invite everybody to please stand and face the flag for our Pledge of Allegiance. Hand over heart and follow me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, thanks, Fred, for the brief introduction. I would also like to welcome and acknowledge our distinguished guests and thank Congressman Waxman, Natalie, Orta, and here we go. Oh yes, please put our cell phones on silence. Thank you. I forgot to. It was right at the top of my list here.
Marcia Davalos.
I have it. Yeah, I have it written out here. Davalos.
Yes.
Thank you, Marcia. And Marcia is with the Small Business Majority. Natalie's with this Small Business Administration. Of course, Congressman Waxman is representing the bill this morning. Also, I'm just going to take a brief moment just to acknowledge our chamber members on the Board of Directors that are attending this morning. We've got our President and CEO, Bridget Carl. Our Chairman of the Board at the end there is Travis Rucci, and our Vice Chairman of the Board, Jacqueline Sousa. Thank you for being here this morning. Okay, I'd like, let's see, okay, this morning, presentation of how the Affordable Care Act affects small business will be presented for the first hour with a 10-minute break, and again, resuming approximately maybe about 20 minutes after 10, if we go the full hour. If we go over, but we'll have a 10-minute break after our first segment here. After that, the attendees our panel members will participate in a question and answers for up to an hour, but we are limited to about 11 o'clock. But we'll play it by ear and see how it goes. At 10:10 or 10:20, if anyone has a question to ask, we'll invite you up to the podium, and we'll give you the opportunity to ask your question to our panel. Congressman, thank you again, and I want to turn the floor over to you.
Thank you very much.
Excuse me, before I also wanted to acknowledge some of the other staff members. We just met them as they came in, and we got Patricia Delagio, who is your chief of staff, Aaron Walensky, who works here for you in the city of Los Angeles, as well as we have Sarah Taymor, who is Senator Fran Pavley's representative. Okay, thank you.
Starting in October, California will be running the marketplaces for the Affordable Care Act. It's called Covered California. Under the law, the states have the option to run the whole system, and California chose to do that. The states also have the option, under the Supreme Court decision, which happened after the law was passed, to decide whether they're going to expand the Medicaid, or what's called Medi-Cal program, for lower income people and those who are not poverty-stricken but lower income, to get their coverage through Medi-Cal. And our state will be doing that as well. In October, we'll be hearing a lot about the whole system in California. But there are so many concerns that people have about different parts of the law, and particularly small businesses and how this law will affect small businesses. There's a lot of misinformation. A lot of people think that this is going to cost them, I think, a lot more than it will, and in some cases it won't cost them anything. That's why I thought it was important to have this presentation, and we're having presentations in other parts of the district. We didn't want a mass meeting. We wanted to be able to have our experts here answer very specific questions that are on your mind. So what I thought we would do is hear a presentation from our two representatives from the Small Business Administration, or the Small Business Majority, who are very expert on how this will impact small businesses. I'll be able to answer questions beyond the small business, and they may as well, beyond the small business aspect of this, but we wanted to focus in, and that's why I'm so grateful to the Chamber for cooperating with us and inviting some of their members and some of the leaders in the Chamber to hear this presentation. How should we proceed? Who goes first?
I go first.
You go first. Yes. So why don't you both present what information you want us to have, and then we'll open it up for questions.
Is this okay? Good morning, everyone. Thank you, Congressman.
And this is Natalie Orta from the U.S. Small Business Administration.
It's my pleasure to be here this morning in the lovely city of Calabasas. So I am with the Los Angeles District Office of the U.S. Small Business Administration, SBA. Who's heard of SBA? It's a beautiful thing. You make my day. Our office covers Los Angeles, Ventura, and Santa Barbara County. It is my pleasure to give you a viewpoint from the federal perspective on the Obamacare, and then Marcia is going to delve into California-specific facts. Are you ready? Well, let's do this.
Let's go.
So, several topics we're going to discuss today. We're going to talk about tax credits. We'll also talk about the grandfather provisions and what those mean to you. Very
that means
important.
A lot to me.
It does mean a lot. Yes, does it? Are you?
I love my grandchildren.
Yes. We'll talk a little bit about employer responsibilities and the individual responsibility requirement for the self-employed, the cost containment provisions of the Act, the marketplace and exchange that Marcia will talk about at some length, covered California, and of course at the end, we'll take your questions and comments. So as far as the tax credits are concerned, right now, in effect right now, as of tax year 2010, $40 billion in credits by 2019. Which businesses are eligible? This is very important. If your business has fewer than 25 full-time employees whose annual wages are less than $50,000, the average annual wages, and you pay at least 50% of the premium cost, your business is eligible for tax credits. Oops, what happened? Wait a minute.
That's good.
Am I going to, okay. My thumb's too heavy. The small business tax credits, they're on a sliding scale. So it's up to 35% of premium expenses for 2010 through 2013, and up to 50% of premium expenses for any 2 years beginning 2014. It's important to note that the tax credits do not cover premium expenses of the owners or their families, nor can they be claimed by the self-employed. Grandfathering, the Congressman's favorite subject. What it boils down to is if you like what you have, you can keep it. So a grandfathered plan is a plan that a small business plan was enrolled in on March 23rd of 2010. Now the grandfather plans do not need to comply with several of the reforms, but they have to comply with some of the provisions. Specifically, some changes can be made. Small changes can be made. In other words, you can add employees, you can change carriers, and the grandfather status will not be affected. However, if there are significant changes, if you're going to drop benefits, increase the premium significantly, that could make you lose your grandfather status. So that's the whole grandfather status piece. The idea of shared responsibility is important to keep in mind. So no business is mandated to offer coverage. This is important to keep in mind. You don't have to offer coverage. But large firms, and what's a large firm? Let's make that clear right now. A large firm is a firm with 50 employees or more, okay? Large firms may pay a fee for not offering health coverage. But let's take a look at this chart right here. If you take a look at the blue circle here, firms with less than 50 employees, those are 96% of the firms in the country. You know, I give presentations all the time, and I talk about small business. People ask, what's a small business? 96% of the firms in this country are small businesses, okay? Less than 50 employees. Now, that 4% wedge there you see in green, that 4% that are small, that are large businesses, they're offering insurance. The only ones that aren't offering insurance are 0.16% of them are not offering insurance. Now for these large employees with more than 50, the large employers with more than 50 employees, if they don't offer coverage, they will be fined $2,000 per year for each full-time employee. That's an employee over 30 hours. That excludes the first 30 full-time employees. Now they only pay the fee if their one worker qualifies for federal financial assistance in exchange, which Marcia will talk about in a minute. And if you don't offer affordable coverage, let's talk about what is affordable, okay? Affordable means the employee's required contribution must not exceed 9.5% of their income. This is such a big problem for a lot of people out there, where the costs exceed 9.5%. That's not affordable health care. We're trying to reach the goal of having affordable health care for all Americans. And the plan has to cover at least 60% of the health care expenses on average. And if they're not offering affordable health care, these large firms are going to be fined $3,000 per year for each full-time employee. There's been a lot of talk about the W-2 reporting, and there's no requirement for W-2 reporting for small businesses. It's only informational in the first place, okay? It does allow the worker to see how much the employer is paying on the health benefits. So it's informational. And firms with fewer than 200 employees are exempt. You don't have to worry about it. However, you have to provide your employees with a summary of their health plan. They need and they deserve to know what kind of benefits they're being offered. Individual responsibility requirement, let's look at this. So beginning in 2014, most individuals have to obtain insurance or pay a penalty. So you may qualify for tax credits based on your income, depending on, for a family of four, if it's from between 100 and 400% of the federal poverty level, that's $23,000 to $92,000 in income for a family of four. And there are charts that break all this out. You're not eligible for tax credits in the exchange if your employer does offer affordable insurance, however. And coverage that's acceptable here would be the employer's insurance, individual insurance, Medicare, Medi-Cal, covered California. There are some exemptions for certain religions, very low income individuals, less than $9,500 a year. So the penalty would be $95, and you'll see, and this is something we're seeing a lot, especially there's a group and they refer to themselves as the Young Invincibles. And these are the folks in the 20s. I've been reading a lot about all of this. And these are young folks who think that they will never get sick or they will never be in an accident. And some folks would prefer to pay that $95 fee than pay for insurance, and that's their right and privilege. But it would be a $95 penalty. It increases every year. So the first year it's 1%, second year it's 1.5%, and third year 2.5%. So about 1 to 2% of the population we expect will just pay the fee rather than pay for insurance. There's some important things going on here, though. What's important to keep in mind is there are these exchanges. So you're going to be able to pool purchasing power to lower premiums. So as a large group, as opposed to you as a small business owner with your small group of employees, that cost of insurance can be so very high for you. But when you're pooled with other employers like you, it brings the costs down for you. Also, more money is going to go to medical care. There's an 80-20 rule that's really important here. What this requires is that the insurers pay at least 80% of the premiums on claims. Administrative costs are limited to 20%. And this has not been the case in the past. This is a very important provision, that 80-20 rule. Now, the insurance companies have to issue rebates by August 1st. In other words, if their administrative costs exceed that 80% limit, those rebates are coming back to the insured, and rebates would be issued by August. So looking at, in 2012, $1.1 billion issued in 2012 across the country. 28% of small business plans got rebates. And increases, and how many of you have, in the past, you get your rates from your insurance company, you take a look, and they've increased the rates by 33% just because? Well, it happens, it's been happening a lot in the past. In the future, any premium increases are going to be reviewed by the state. This is not just we're going to raise the premiums because we want to. That will not happen in the future. And there are incentives. There are the whole thing of incentives for efficiency, modernization, the whole pay for performance. And there's a hidden tax in there that they're trying to reduce. That's $1,000 a year. A lot of hidden costs that little by little are going to be eliminated. Oh, my heavy thumb. Kind of a summary of what I've said here. So what's really important here to talk about? First of all, there will be no denial of coverage because of pre-existing conditions. And this has been an issue for many, many years now. This will not happen in the future. And oftentimes because you have a pool of employees looking for insurance, and one of your employees had a pre-existing condition, and then your pool of employees couldn't qualify because of that employee, this will not happen in the future. Another thing, did you know that insurance companies could, in the past, charge higher premiums just because she's a woman? There will be no gender discrimination insurance premiums anymore. All the plans include 10 essential health benefits. And Marcia will also be referring you to some websites. We have them at the end of the presentation with a lot of detailed information about what those 10 essential health benefits are. One thing that I can tell you that affected me, the dependents can stay on your parents' plan until they're 26. You know, my son turned 24. I was panicking. I mean, what do you do as a parent? It's such a concern. Now they can stay on until 26. And once they're 26, they better be on their own. They've got to figure it out, right? That's what I say. I don't know if they're going to move out, but they should be on their own by 26. That's what I say. And no lifetime caps on what's paid out to you. That's another important thing to keep in mind. So I've given you a very broad brush view from the federal perspective. Marcia is going to dive now into the California plan and the marketplace. Marcia, take it.
Take her away. If you can click to the next slide, please, Natalie, that would be wonderful. And so just before I start, I just want to let you all know that we have, if you let Natalie or myself know or give us your business card, we can email these slides over to you in the future. So, you know, I see there's some people that are taking pictures and writing notes down, so just so you know, you can have a copy of these. So real quick, I just kind of want to go over, you know, who the small business majority is, like who we are, and then I'll get into the really exciting stuff, which is California specific, because I know everybody's dying to hear that. So real quick about the small business majority. So we're a national nonprofit advocacy organization that's really focused on issues that are important to the small business owner, founded and run by small business owners. So we come from a very different perspective, which is, I believe, a more pragmatic approach. Which I believe the small business owner really makes decisions based on bottom line. You know, so we're based in California here. We have our office in Sausalito, and we have offices throughout the country. And we're research and advocacy organization. So we do a lot of research that that really focuses on these issues that are important to small businesses and the self-employed. We do a lot of polling. And, you know, cost containment and, you know, lowering expenses is always what seems to come, you know, on the top one or two items that are important for small business owners. So we've been very focused on healthcare costs and making sure that healthcare costs are palatable for small business owners. For the past 6 years, this has been a very big focus of ours. So, moving on, I told you that we do a lot of research and opinion polling, and scientific opinion polling. And let me tell you what the difference is between, regular polling and scientific opinion polling, because a lot of advocacy organizations tend to poll their members, right? And when you poll your members, well, obviously you're going to get a very skewed perspective of, what it is that you're really asking them. So we don't do that. We ask questions to small business owners at large, right? And this is people from both sides of the aisle. So that's very important. So, a 2008 study that we did really, right about the time when healthcare was going to pass, and, right at a time when this was a real heavy conversation, what would happen if we didn't do anything with healthcare costs? What would it look like? In 10 years, if we did nothing, we know that healthcare costs would more than double. That's more than 5 times the rate of inflation. If we left everything the way that things were going in 2008. Now, we've already done some things that have already changed that, so, don't be scared. Things aren't, healthcare costs aren't going to double. Now, we've already changed this perspective, so, but that was a 2008 study that we did, very interesting. We know that small firms pay, on average, 18% more than large businesses. And this is for everything. This is for healthcare costs. This is for overhead, for, basic costs that both small and large businesses have to spend money on. We know that small businesses are paying a whole lot more for this. A lot of talk about who this uninsured population is. So much conversation about the uninsured being the lower income, the low wage, lower income. Well, it's a real shocker when people really hear that about 30% of the self-employed population here in California are uninsured. 30%. These are people that are working hard, small business owners, that they just can't make those ends meet to pay that and to cover the cost for their health insurance. 25% of small employers that have, a small amount of staff, uninsured, simply just can't afford it. It just doesn't work with their bottom line. So, another one of our surveys that we did, which really, talked about California small businesses in specific, 86% of California small businesses don't offer health insurance, and the only reason, it just costs too much. We just simply can't afford it. If we could, we would, but we just can't. And, 70% of the businesses that are currently offering health insurance, they say we're offering it, but we're struggling. We're struggling to do so. And we know that if anything happened, an emergency were to happen, or something, some unforeseen cost that we, didn't take into consideration, we don't know if we'd be able to offer them coverage in the future. So, this is what we're hearing our small business owners say. So, now moving into the exciting part, which is the health benefits exchange. So a lot of talk about what these exchanges are and what these are going to look like. So, I think, we like to look at it as like like a one-stop shop web portal. Now, let me explain that. So what is this like one-stop shop place going to be like? So I don't know if exchange is a really good word for it, because I think it kind of implies it's like a this for that. But I think a marketplace is a really, really good term that really, it really explains, what this is. So in a sense, this is going to be a large marketplace where you're going to be able to go to buy commercial insurance. Talking about the Congressman mentioned it a lot about the misinformation that is out there. A lot of people are thinking that they're going to be able to buy government insurance. No, this is commercial insurance that's going to be sold. None of like government-run programs or government-run insurance. It's not. It's already existing commercial insurance providers that are out there that are going to sell their insurance within this marketplace. This marketplace. There a lot of talk about it being something similar to buying a book, like buying a book on Amazon.com. I think Amazon is a little bit more of like an oversimplification, but they've also compared it to like travel sites like Travelocity, Orbit, something like that you're going to be able to go in. It's like a web portal, put in your information, your specific information, your your name, what your family, or the size of your business, your zip code, because this is all going to be based upon your geographic region, and then you'll be able to compare. You'll be able to see all these plans that are going to be available for you to purchase. All the plans are going to be laid out in a very easy format that you're going to be able to understand and look at, and you're going to be really able to compare these plans across the board, which is, the price, what they're going to offer, who's going to be providing them. So it's going to be in a very clear manner that all of them are going to look uniform, like across the board. So this is not, before what insurance companies do. It's like you're looking at one, and then one has the fine print, and then it covers, this and this. And then so you compare it to Kaiser's plan, and you're like, wait, how does this match up? And it almost leaves that person almost thinking, like, how do I know if I'm really going to get what it is that I really want and really need? So, and plans are going to be organized by level. Very basic, very simple. I think that, for all of us to understand, bronze, silver, gold, platinum. Pretty basic, right? We know that a bronze plan is probably going to cost less, but out-of-pocket costs are going to be a little higher versus your platinum plan. It's going to cost more, out-of-pocket, less cost. So, that's the way it kind of works. There's going to be a calculator in this portal, in this marketplace, that's going to allow you to compare costs across these plan options. So, what am I really getting in the platinum plan that I'm not getting in the silver plan? And, what does that really look like? And what's the price difference going to look like? So you're going to be able to see all this very, very clear. And a streamlined billing process, which is actually really important for the small business owner, because it's going to take a lot of that administrative burden off of the small business owner and that individual that's purchasing the insurance through this marketplace. And I'll go in a little bit more detail about that in the upcoming slides. So this benefits exchange. So, there's going to be two different exchanges. So this is the way I like to look at it. So the exchanges in this marketplace is going to have two doors. One of the doors is going to be for the individual marketplace, and the other door is going to be the small businesses. And the small business door is nicknamed SHOP, which is the Small Business Health Options Program. And so currently, in order to be able to enroll in the small business in the SHOP plan, you have to have at least anywhere between 2 to 50 employees. And that's for 2014. In 2016, that's going to change. It's going to allow for up to 100 employees. So it's going to expand. But for starting, it's to 15. So, like the Congressman said, this is going to be opening January 1st, 2014. We're going to be ready to rock and roll with these insurance plans. Pre-enrollment is going to begin in October. So pre-enrollment is going to begin in October and extend for the first 3 months before the plan opens and the 3 months after that. So it's going to be going from October to March. And then every year after that, it's going to be from October to December. So the first year, just to really allow a whole lot of people to really understand and really understand what's going on so that they can see what's going on. Open enrollment is going to be open for 6 months. So this is completely voluntary. The exchanges, the marketplaces, completely voluntary. Now, the only people that this is not mandatory and that this is mandatory for is our members of Congress. Now, apparently, when they were putting this bill together, they said, this is going to be so amazing that we're going to stand behind this and make it mandatory for us and our staff to have health insurance. We're going to purchase it through the exchange. So I think it's pretty interesting. A lot of people, like that. When I tell them that, starting January 1st, we're going to have access to the same plans that our members of Congress are going to have. So I don't know if any of you find that exciting, but I kind of do, right?
That's why I'm here.
Exactly. So exchanges are designed by state. So we've heard every state is going to have an exchange, and so each state has the ability to start their own, which is, I think, it really benefits, especially for California. I mean, this really means that this gives us the flexibility to really set up our own exchange that is, very tailored to California, to what fits our needs. Because obviously what is, necessary or important to California is, very different to the state of Idaho, right? I mean, there's a lot. The population is different. The needs, the makeup of the state is very different. So this really allows each of the states to really form these exchanges based on, how it is that their population shapes out. This is not a new concept. This has been around for years. There's business groups that have done this and that have, come together to make these marketplaces to say, let's pool our purchasing power here, and all get together and buy insurance, through one carrier to bring the prices down. So, nonprofits have done this, state governments have already done this and run similar programs. California, Connecticut, Massachusetts, New York, Utah, all these states already have a version of an exchange or some sort of marketplace that they're already running. So California specific. California loves to name their programs, right? CalFresh, CalWorks, Medi-Cal, you name it, California wants to put a stamp on it and says, this is ours. And so they have named our marketplace Covered California. So just a little bit of background, a little tidbit. Some of the final contenders for the names were Condor. Yeah, that one kind of made me wonder. Avocado. I kind of like that one. It kind of grew on me after a while, but then, avocado was, tossed to the side, and then Covered California came in and, and took the cake. So, so we're stuck with Covered California. That's our logo. So, so if you see any other logos that are not like that say that this is a California marketplace, it is not Covered California. So, starting, in 2010, California said, let's get to this, let's start our own exchange right away. So we were actually the first in the nation to really enact our exchange. And it was a huge bipartisan effort that started. So we had members from both sides of the aisle really come together and really kick this thing off and said, since we're going to do this, we're going to kick this off right. So very important to know that this is governed by an independent public board. A lot of these presentations that I go to and I say this, people are like, yeah, those politicians that are running this. This is not. This is an independent public board that's running this exchange. And they're holding dozens of public board meetings. Another one of which I just received an email yesterday that they're going to have a town hall. So Covered California is coming to Los Angeles on June 7th, and they're going to be having a town hall. And if any of you are interested in that, please, give me your information and I'll forward that information out to you. Where Covered California and the board, the 5-member board, are typically anywhere between 2 to 3, maybe sometimes 4 of the board members show up, maybe not all 5 because they're all in different parts of the state. So they come to, they had their first one in San Bernardino, and so now this next one is here in Los Angeles. And they really go out there and they answer questions for the public. Anybody, can really go there, stand at a podium. There's a lot of people that, stand at a podium waiting in line to ask questions, and they answer questions. Very, very open, transparent process. The executive director is a former business leader, which I think is extremely important, right? To just know that you have a person that really has that business sense versus to have somebody that has, I hate to say it, but, just all they know is the bureaucratic process, right? So this person really knows what it means to run a business, which is what Covered California is supposed to run like. So all the money that has been used to run this program and really, start it up and everything, it's all federal dollars. So they have not used any sort of state funding to do so. This is all federal money that has been coming down. And starting 2015, this exchange is supposed to be self-sufficient, self-funding. So the money that they take in is, really going to be to cover their expenses, and, that's really how it's set up to be. So by 2015, it's going to be self-funding. So they have a lot of advisory panels, one of which the Small Business Majority sits on, the Small Business Advisory Panel, which we provide input. They ask for input from these advisory panels, and they actually do listen to us. So a lot of people are asking me, they have, so many things to say, and they're like, well, we don't even know what they're doing. Well, you know what? I do. I've been attending these meetings, and it's a very open and transparent process. Everything, all of their meetings, their agendas, everything that they're putting out there, all the suggestions that they have is public record. There's a website, very wonkish looking, so it's really kind of hard to like sift through, but if you're really energized and really into it, you can really find a whole lot of information here. All the public comment that people, they take extensive notes and constantly post it, and then they come up with an idea and they say, okay, next time we convene, we're gonna, take action on this measure. And so they have public comment. People stand in really long line, 2 minutes each, and they sit there and listen to every single person give their 2 minutes of comment. And they come back the next month and they make decisions based off of what people said. I think it's pretty incredible, but to see it actually in process, it is happening. So some of California's really key decisions. So this is what is specific to California. So California has this active purchaser program, which is extremely important. So, other states don't have this, in saying that, other states don't really have a say as to who the insurers are going to be that are going to be selling insurance through their own marketplace. Well, California had the ability to really negotiate with these insurers to be able to say, okay, this is what we want. We want all of our plans to cover X, Y, and Z. So this is our criteria. So the insurers had to come to California and say, all right, we're putting in our bid, and this is it. These are the plans that we're going to offer. And the exchange actually looked at some of the insurers and they said, no, this is it. You're not offering enough coverage, and this doesn't look right. So we're not going to allow you to sell insurance through our exchange. So they really had this whole, they were really able to negotiate this, which really, it allows for us to have a very apples to apples comparison, to really understand that the silver plan that we're going to get with Kaiser is the silver plan that we're going to get with Anthem Blue Cross, right? Really allows us to really compare apples to apples as to what we're buying. Employee choice, huge. California has this, which really, let me explain this to you, because a lot of people are like, well, what does this employee choice really mean? So, as an employer, my employees here, right? You're all getting coverage, and let's say the minority of the room loves Kaiser. You guys love Kaiser. That's all you want. And you want your health plan to be Kaiser. So I say, all right, everybody can pick a gold plan. So as an employer, I'm going to pick the tier, which is gold. So everybody gets to buy a gold plan. And you yourself, as an employee, can pick who your provider is going to be. So this side of the room say, we love Kaiser. This side of the room says, half of you like Anthem Blue Cross, the other you like LA Care, or, what other, providers are out there, Blue Shield. You get, as an employee, you get to pick who your provider is. And the employer gets to write one check, write one bill over to Covered California, and covers everybody. So it's really interesting. It takes off a lot of the administrative burden off of the small business owner, to really be able to offer all their employees their choice, and then them just really send one bill, one payment over to California that's going to cover all of it. Brokers, really, really important part of this process. So at the beginning, brokers were up in arms saying, oh my goodness, how is this going to happen? It's going to put us all out of business. No. We know that brokers are a big part of this, and they're going to continue to be a big part of this, especially for small business owners that don't have the time to navigate through all of these things. Brokers are a very big part of this. They're going to be paid market commissions just like they are. All of the plans that insurers sell within this marketplace, insurers are going to have to also sell outside of the marketplace at the same exact cost. Now, why is that important? It's so that brokers or anybody else can't undercut the exchange and say, well, they can get it through the exchange, but if they get it outside the exchange, it's like $200 cheaper. None of that. It's the same across the board, right? So you get to pick, who it is that you, and as a small business owner, you kind of understand, well, a lot of the administrative burden is being taken over by Covered California, so why doesn't it make sense? So it really, allows for the small business owner to make that decision. So brokers are a big part of this. They're going to stay and remain a big part of this whole equation. HR services, which are, other services that Covered California is also going to cover. COBRA administration, HSA plans, wellness plans, you name it. COBRA is a nightmare for a lot of employers, right? They're like, oh my goodness, taking on a lot of that burden. Covered California knows that, we're in the business of doing this, so why not be able to provide that to our insured? Why not be able to provide that to our small employers? So they're going to be handling a lot of those HR services. Once again, a lot of the administrative burden that's being taken off of the small business owners' shoulders. So once again, this is a public-private partnership, which means that the exchange is really contracting with a lot of private sector vendors to be carrying out a lot of these tasks, because the exchange knows that they're not in the business of running service centers. They have no clue. So they're contracting with a private vendor that knows how to run service centers. They're not in the business of putting together a huge web portal, huge internet portal. So they're contracting with Accenture, a really big company that knows and that has the history of doing so.
Let's get to the questions pretty quickly because of the.
Okay, am I taking a lot of time? Okay,
Well, yeah.
real quick.
Yeah.
So these are some of the decisions. This actually came out last week. These are the companies that are going to be the insurers that are going to be selling insurance through this exchange, so that you can see. We'll get back to this information, if you want later. And then these are the going rates that actually just came out. A lot of conversation about rate shock, right? Oh my goodness, these rates are going to be so high. Well, we have seen here. So if you look right here on the left side, when you see two Los Angeleses, right? The second to the third to the bottom is Los Angeles North. LA was so big that they had to split it up between North and South. So we fall under LA North. And if you look all the way to the right, that line is the difference between average Covered California Silver plans in comparison to small group plans right now. So we know that on average, rates are going to be 22% lower than current rates. These are 2013 Covered California rates. Average 22 to almost 30% lower. So these numbers just came out last week. They're very fresh, very new, along with a lot of other information, but we can definitely move on to the questions. And like we said, these are a lot of really, really good resources that you'll be able to find a lot of good information, both for small business owners. The Small Business Majority, which is our website, has an actual calculator, so you can go in there and to find out if you qualify for the tax credits, put in your information very quickly, and it'll give you an idea. And if you don't qualify, it'll let you know ahead of time, because we've heard that there's a lot of kind of like administrative burden to find out whether or not you qualify for the tax credits. So this is our contact information, and I think I'm done with my portion, so we can open it up for questions.
Good.
Thank you.
Did you want to? Yeah.
Thank you, Marcia. We had a plan to take a break, but we don't have to take a break if we're on a roll here. If you want to just go right to questions.
Let's go.
Yeah, I think that
Okay.
would be the best.
All right.
Let's just have people line up at the
Okay.
mic and
Do we have
ask
any
a question.
questions that we would like to pose to our panel? Just step up here and we'll sort of put you. Okay, here you go. Thanks.
So I have a couple questions. Earlier in the year, there was a program that allowed for uninsurable people to have insurance. And I understand that, I think it was like a $3 billion funding, and there were 100,000 people across the nation who enrolled, and then they ran out of funding, which basically equates to $30,000 per person. So for an uninsurable person, that's peanuts. My second question is that you had mentioned that it is not mandatory to have insurance, but I understand that there is a per person penalty and a per business penalty, and that's administered through the IRS that you have to fill out on your IRS form. If I choose not to go as an individual through the exchange, which I understand is basically a group policy for the state of California residents, that's all you've done is created a group. If I choose not to go through that group and buy my own on my own, is that possible, or do I have to, as an individual with a certain income living in a certain zip code? And then my last question is that the Healthy Families went bankrupt, which is basically the same thing as what you happen here. So if you have a bankruptcy of the uninsurable, you have bankruptcy of the healthy families, what's to guarantee that this new program isn't going to go bankrupt?
I'm going to have them answer some of their questions, but in the Affordable Care Act, there were people who could not get insurance, mainly because they had pre-existing conditions. And they were turned down if they applied for it, or they were asked to pay such an exorbitant amount of money, they couldn't afford it. So for those people, there was a temporary program to last until January of next year, where they would be able to get, as a high-risk pool, coverage. That was supposed to be funded to a great extent by the federal government. We didn't get enough funds for that, and we were looking for ways to replenish it. We haven't been able to figure out a funding source, but that affects those people who are uninsurable at the moment on a temporary basis, because in January, they will be able to get insurance at the same price as everyone else. So that's that fund. The Healthy Families Program, which is what the state runs for a combination of the Medi-Cal and the Child Health Insurance Program. The problem was not the federal dollars, the problem has been the state dollars to match it, and that the state has struggled with under the downturn in the economy. But I don't think it's bankrupt. But let me have our experts answer the other very specific and very good questions you asked, if you wrote them down.
Right.
Okay,
Yeah.
good.
Okay, and it was specifically to address the fact that it's, that nobody's, that the individual mandate, right?
Right,
That's
because
what it
my
is.
understanding is that on the 1040 form that's coming out, that I have to write down whether I have insurance, and
The
there's
mandate for for individuals, and what mandates there are
and it's a
for
$95 something, I don't know, a month or whatever
Right.
penalty, and for
Okay,
businesses.
so yeah, let me break it down and kind of split it up between small businesses and then individuals, right? Because individuals does fall under the guise of like the self-employed. Starting with small businesses, like we had said, under 50 employees, you don't have to do anything, right? It's the larger businesses with more than 50 employees that either have to offer affordable coverage, or they're going to have to pay a fee if that coverage is not affordable for their employees. And let me just give a quick example of how that works out. So say that you have like a law firm that has a lot of attorneys, then you have a mail clerk, right? And they're offering platinum plans for all their attorneys. And then that mail clerk, that's too expensive for them, to be able to afford on their salary. So if that insurance is not affordable for them, then there's a fee. So that's how that fee works out for businesses, right? Now let's move on to the individuals, also the self-employed. Well, if you make less than $9,500 a year, you don't file taxes. So you don't report anything with the IRS. So then you're not mandated to purchase health insurance because you make less than that certain threshold. Now, if you make more than that threshold, yes, you do submit your tax forms to the IRS, and you're right. The IRS is that enforcement agency that is going to, and how this works, I'll give you just like the really wonkish details of how it's going to be. So when you put in your information, Covered California website, it's actually going to ping the IRS, right? Your Social Security, it's going to ping the IRS. The IRS is going to know, okay, how much is this person's income? So they're going to know right away what your income threshold is. So if you're within 100 to 400% of the poverty level, chances are the majority of the cost of your insurance is going to be subsidized. So if you fall underneath that,
Let me ask this one question. So if I am, because I don't know what the poverty level is in my zip code, if I am in that poverty level, but I live frugally, and I choose to buy my insurance outside of the exchange, will I be allowed to do that? Or because I'm in the poverty level that's been created, which doesn't take into account that I don't have this, and I don't have this, and I don't choose not to have this bill, and I choose not to have
Right.
that bill, so I have the money to
Right.
pay
So-
for it. Will I be allowed to pay for health insurance outside the exchange, even though
Yes.
I'm in the poverty level that's been created
yes.
by a figure?
Yes. As I said before, the only person that the exchange is mandatory for is for our congressman. That's it. It's completely voluntary for everybody else. Now, you have an individual responsibility to purchase insurance. It doesn't matter where you get it from. It doesn't matter where. So you don't have to purchase it through the exchange. If you're already getting it, if your employer is already offering it to you, if you're going to get it Medi-Cal, any other program, fine.
So
No-
if I'm uninsurable, I have to get it through the exchange, but if I am in the poverty level and I don't want to get it through the exchange, I'm in this bogus area.
No, you're not. You're not. I mean, you're not. No, you're not. And you have to. If
I'm
you make
uninsurable. I'm uninsurable. I got the polio shot.
We can
I got
talk
polio
about this a little bit more
Okay,
afterwards.
let me explain. I got polio shot in vitro. So I have the ramifications of polio. Nothing I did in my life. So I became uninsurable from the time I was born.
I hear
So
you.
I have this big thing that I'm really curious about
You
what's
will be,
happening.
you will be able to get insurance without any discrimination.
Right.
You will be able to pay the same price as other people. So there's no one that's uninsurable because of a medical condition. You will,
Okay.
may have trouble paying for it, but we're trying to figure out how to help people pay for their insurance. So we're talking about individuals. You want to buy an insurance policy for yourself, you could go anywhere and buy that policy. But if you want to take advantage of this marketplace, you will have choices of different insurance policies. They will not ask you what your medical condition is because it doesn't make any difference. And then you will choose the policy you want. If your income level is at a certain point, when you choose a policy, you may get tax credits to help you pay for it. And that is not tax credit you get later. It's a reduction of the premium that you will get immediately, so you will be paying less for that policy. If you're not eligible for any tax credits, you're above a certain income level, you will pay for that policy. If you don't want to buy it, you don't have to buy it, but you may then have to pay a penalty under the tax system for not having any insurance. But if you go outside the exchange and buy a policy, you can do that, and you don't have to pay anything to the IRS as a result.
Okay, thank you.
Sure.
Okay, I have a lot of little questions. Basically, can you pick your own doctor, or how do you get your doctor? That's one thing I'm curious. And I don't know if you want to answer these as we do them. That's fine.
Okay, everything's going to stay the same. So the way that it works right now is your insurance company has a certain network of providers that they work with, and that's going to continue the same way.
Okay, and they're going to be able to, when they go in the marketplace, to pull up Blue Cross or whatever it is and see all the providers, and they say, oh, that's my doctor, I can go there.
Right,
Okay.
right.
And will it actually say like Dr. Jones, and it'll say Dr. Jones is with this plan, this plan, this plan? Will it do that? Because that's one thing I find that
You know, they've
even now it doesn't
So
do that.
I've seen little tidbits of what this website is going to look like, but it's not completely finished yet. So I don't have a specific answer for you as far as what exactly it's going to look like. I'm not going to lie, you might have to do a little bit of research on your own to make sure that, you know, your medical provider, your doctor, maybe you might want to call your doctor and say, hey, does this plan cover you? Just in case, just to be sure. So I don't have a specific answer on that question for you just yet, just because it's not finalized yet.
Okay. On the doctor's level, are they supposed to now join certain things? Is there something that says now with this whole thing going on and there's so many other plans, are you guys, whomever, the board or whatever, saying that you need to now be part of so many plans?
So, can I take this one again? So I know that you, like, say USC Medical Center or like Keck Hospital, they are just now under contract with Anthem Blue Cross, I believe. So they're going to all be covered. So it's individual. It all depends on that particular hospital
Okay.
and whether or not that insurance company or that provider is going to contract with that specific group of doctors.
Okay.
No mandate on the doctors. Doctors have to make decisions of what plans they want to take insurance.
So they still have their own choices,
Yeah.
basically. Okay.
And, you know, this is an evolutionary process. I mean, we're working into all of this. but
Right.
No major changes.
Okay. How does part-time employees fit into this?
So on the calculation of whether or not you have, you fall under 50.
Yes, I'm
Very
under
much so.
50.
So it really makes no difference for you.
Okay.
I mean, it's your choice whether or not you want to be able to offer that or not. I mean, I don't know. You might want to take a look at the tax credits, because if you add more people to your policy. You know, next year, if you're, they work on a sliding scale, so the smaller company you are, the larger tax credit you're gonna be. So you may be able to apply for up to 50% of the premiums that you pay, you're gonna get back.
There was a 50,000 figure there if a full-time employee
Average.
makes more than 50,000.
Average 50.
Oh, average.
Average.
Okay.
So more and less.
So including part-time employees,
Yeah, you
that
just average
falls
them all out.
within. Okay, and does
You
that
look
also?
at the tax credit calculator, that will really benefit you.
Okay, and that also includes the officers, if corporation, whatever, it's officers as well as employees.
You know, I believe so. I believe that you may be able to, you know, add them all into the plan as well.
Okay.
I'm not exactly sure about that because that has not gotten ironed out yet. I would say in about another month, we'll know exactly what the shop. These numbers that I gave you up there, those are individual. They're not the shop numbers. So shop is going to come out mid-June. So mid next month, we're going to know the numbers for shop.
And I'm gonna wrap it up to
Her
leave them
question is,
from our
what would be
people.
covered? That's not clear yet?
Oh.
Your question was who in the small business would be covered, whether it's the board as well as the employees?
Exactly,
Yeah.
exactly, yes.
And that hasn't been worked out yet?
I believe that, like, those details, but, I mean, I'm assuming that you can more than likely, like, pull everybody together.
Okay, officers and employees
Yes.
as well,
think so,
okay.
yeah.
You'd have the option to.
The other thing is, I noticed when you had those numbers up there for, what was it, northern, southern,
Okay.
LA or whatever,
Mm-hmm.
I didn't see Kaiser there, anywhere in there, and Kaiser is
Well,
very prominent within LA.
Kaiser is the bottom right.
Can you go back?
So they're there. So this one, these are just silver plans. Oh, Kaiser's there at the bottom. See San Diego, Kaiser?
Well, that's San Diego.
Oh.
Does that mean that I have to go to,
No, this is just.
this is what I'm trying to understand. If-
There's this, so you all know, there's this 80-page document that really has really extensive information, and it really has
Okay.
by like every single region and then the numbers and all that. This is all available online.
Okay. I also want to say thank you for coming. I appreciate it.
Thank you for having us.
Just a quick question on statewide and national. So if a company has people scattered throughout the state, they'll all be rated by their own zip code?
So I believe that that's going to be, it all depends on where that business purchases the insurance through.
So if we're in Los Angeles and we buy, and the employees are statewide,
Right.
it all comes out of what's LA's rating?
Right.
By where the company is?
Right, right, where the company purchases their health insurance, okay?
So that would be one company would pick one location to buy all of their statewide insurance?
You know, and then this is the stuff that's actually gonna get ironed out next month. And so we'll know exactly how that's going to look, but yes.
Okay, and on a national basis, the states that'll choose this type of exchange, so if a company has employees in multiple states, their rating will be by state, where their headquarters, for example, or subsidiary in that state is located.
I don't know how other exchanges are going to be running that, simply because a lot of them are federal, like, they're all federal exchanges that are being set up, that aren't existing, they're not set up just yet. So I don't know the answer to that question for the entire country just yet.
For the congressman, does it look like there'll be a national system where one employer will be able to buy for everybody in their company?
I would think so. I would think so. Let me raise some other issues with your question.
Sure.
If you're providing insurance for your employees, if it's, and this raises the question, don't the employees get to go to the exchange and choose?
Well, if your employer is offering you insurance,
If I'm the employer.
Yeah.
if you're the employer
Right.
and you're offering your employees insurance,
Right.
then no, they cannot go as individuals to the exchange and take advantage
I see.
of the tax credits within the exchange if your employer is already offering it. Now, how many employees do you have?
Over 50.
Over 50? So then you couldn't purchase insurance through the shop, at least not right now. So-
That's why I'm asking on more of a national basis.
You're going to be,
Is that
you're going to
gonna
be where you are
available?
now. If you're going to provide insurance coverage for your employees and more than 50, you will decide what appeals to you and what you
Right.
think is sensible, and you'll buy insurance coverage for your employees, whether they're in San Francisco, San Diego, or Tucson, Arizona. That
Right.
won't change. It doesn't make any difference.
But the
If you- if-
rates is what I'm kind of looking for more, is that will there be a national package that'll basically control the rates the way something like California system
Yeah,
is?
that's,
So
yeah, go ahead.
there's already, so California just put out their numbers last week, but like 2 or 3 weeks ago, 5 other states put out their rates. And also, they're on average 18 to 33% lower than current rates as well. On the West Coast, Oregon and Washington, the same, around 30% less. So it's looking like that those rates, at least right now, they're going to continue to stay lower, like across the state. So
As a technical question, if I have less than 50 employees in California, but my company has more than 50 employees nationally, I can separate my business in California and take the exchange as a benefit?
I think that's an IRS call. So if you're going to be separating them as far as tax purposes, then more than likely you can do so by setting up separate companies. But like I said, IRS is going to be the enforcement agency, so it's really going to be their call.
If you're an employer and you cover your employees, that stays the same.
Right.
The idea of the exchanges were that small businesses couldn't get the lower rates that large businesses get because they have more of a population to be insured.
Right.
So they would be pooled together to get the same kind of rates. Now, if it turns out that the exchange is offering lower rates
It
than
looks
what
like
you're
it.
getting,
Right, it looks like it.
if that's the case, then you go around back to your insurance companies and say, your rate should be comparable. Why should I be paying
So
more?
we start to force the issue really from our side as well as you
Yeah.
pushing from the political side.
Right.
Fair enough. Thank you.
Good morning. I'd like to kind of expand on what the gentleman was just talking about, because one of my clients has posed a question that here's a couple different locations, and right now on each one we have on average of about anywhere between 75 and 90 employees that are full-time employees. But the law requires that if you have 50 or more full-time employees, then you have to go ahead and provide the coverage. But if we go ahead and go with 40 full-time employees and have about 80 or 90 part-time employees, is there an apportionment schedule that will be implemented to say X amount of part-time employees are equivalent to a full-time employee? Or can you manipulate the system like that? Because one of my clients has already spoke with his insurance company that supposedly has all the information for the exchanges, and we're looking at approximately, on the insurance agent's calculation, it's going to cost them approximately $800 and some thousand to implement this for all 3 locations.
Then let me just give you the calculation. So it's full-time equivalent, right? So when you're calculating the penalty, okay, it actually makes you have to add up all your hours and then divide them by the amount of employees.
So it's
it doesn't matter if it's
equivalency.
full or part-time.
So it's irrelevant then.
30 hours is full-time equivalent, not 40.
Right.
Because, a lot of companies have adjusted down so that they don't fall underneath that. Well, if you adjust it down even more to less than 30 hours, we've already seen what's happened before with, Applebee's and Olive Garden
Yes.
that cut their staff and quality went down and they, rescinded what they said and then they went back to business as usual because they saw that their model and quality and the people customers started complaining. So, that's the whole point of this. It's like, really at a certain point and with the amount of employees, what kind of employee retention are you looking to have here? Are you like a transitional employer that really just employees transitions for a small period of time and then lets them go and you don't want to offer insurance? Or are you really interested in keeping a very efficient, healthy, sustainable staff? So there's that question. Now, getting back to the equation. So say you have 51 employees and you really do your, math, or take that, all that into consideration. In charging that fee, you have to discount the first 30 employees. So if you have 51 employees, right, full-time equivalent employees, you're really only paying a penalty on that 21. You have to discount the first 30. Now, if it's not affordable insurance, right, that what I explained earlier about the law firm and then the 9.5, it exceeds 9.5% of their income. Now that right there, you don't discount the first 30 people. That's for every employee that does not have affordable insurance. Then that's $3,000. One other key component of this. Once again, the triggering mechanism that triggers these fees is the IRS. So in order for these fees to be charged to this employer, one of those employees, has to go to the exchange, to this marketplace, to the individual marketplace, and try to purchase insurance through the exchange, right? What that's going to do is when they put their information into Covered California website, that's going to ping the IRS. And the IRS is going to know, all right, well, this person has an employee that they're already offering coverage to, but their employee is looking to get that tax subsidy through, the exchange. They don't do that. First of all, you can't do that. You can't benefit from a tax subsidy if your employer is already offering coverage. And so, but then again, if you're an employer and none of your employees go and try to get insurance through the exchange, you're fine. You don't have to pay a penalty. So I don't know how this fits with your example. If you have any further questions, I'm going to give you my card. You can talk to me afterwards.
I will give it, because the full-time equivalency, as far as what the formula will be to do the calculation for that, it could automatically trigger anyone who's trying to bifurcate the system will be caught. And especially if one ping could generate a question like what it does right now with the Employment Development Department, the IRS is going to end up going ahead and having a whole different division on this, which is going to create one heck of a mess.
Well, we have, once again, this is the biggest set of patient
Right.
consumer protection laws that we've ever seen in our lifetime. So a lot of this that's going to happen is very unprecedented. So I don't know what's going to happen, to be quite honest with you. I mean, some people think that having the IRS play a role in this is actually a good thing. I think in light of, what's just happened, it raises some questions. But I don't know. This might be a very efficient, we don't know. We don't know what's going to happen in the
We'll
future.
see how it plays out.
Right.
Because right now it is a fantastic program to come, especially with the first woman who spoke about by not being able to have coverage. Everyone will be able to have coverage.
Exactly.
The thing is, the employers are going to look, how do I protect my bottom line? And that's what it boils down to. Thank you very much.
Thank you.
I have several questions, but thank you very much, Congressman Waxman, for coming to Calabasas, and Marcia and Natalie both. And this has been very helpful, I think, to all of us. And you're always welcome in this city hall and this community. So don't be a stranger. We'd love to have you here. I'm involved with a number of NGOs and nonprofit organizations, and we hire and manage people to do social benefit of one kind or another. What are the implications for those who are working as employees of nonprofits or NGOs, non-governmental organizations?
So, that's another thing altogether. But, it really depends on how many employees this NGO or this social enterprise really does employ. So as far as the equation is concerned, it's still that 50 employee threshold. If you're less than 50 employees, then you don't have to worry about it. But if there's more, then that definitely is something that you need to take a look at. A lot of NGOs are currently working with brokers that really handle large plans, and especially social enterprises that have 150, 200 employees that are transitional, that they only have for 8 to 13 months, and then they transition out and go. So a lot of brokers are currently working with those, and I'm really thinking that brokers are still, like I had said earlier, a big part of the equation. So really, for that organization, talking to your broker is probably going to be the best way to see what is going to benefit you. Now, as far as the tax credits that are available for small businesses, they're still available for, nonprofits and NGOs as well.
They are.
They just have to fall underneath that threshold of, less than 25 employees, average $50,000, income, salary, and
Less than 50,000, you say?
average less than, yes, average less than, and less than 25 employees. So if that nonprofit falls underneath that criteria, then it's there. But if those social enterprises, they're really they're all so different and all very unique. And I just had a conference on that like 2 weeks ago, in downtown LA, where we talked about social enterprises. And Goodwill was there actually too. And they talked about how, when Natalie talked about the insurance companies receiving rebates back, Goodwill received an $80,000 rebate back from their insurance company. I thought that was really interesting.
Already?
Already, yeah.
Right,
For last year. I was like, oh my goodness. So, there you go.
I would like to talk to you about some of the specifics, because some of the nonprofits, are a little intricate or unusual, so
Right.
I want
Yeah,
to talk about that.
We'll talk detail.
Can you speak about what happens to the waiter who is a tip-based earner and who is maybe full-time, maybe part-time, but it's at the whim of the operator of the restaurant? You got a shift or you don't have a shift. And we have 800,000 food service workers and service personnel that are in a very peculiar place. Can you give me some idea how this system is going to be helpful to them? I have a son who is uncovered and who has a restaurant that does offer health care insurance, but it's unaffordable, and those folks can manipulate their schedule in a way that they don't have to actually put the benefits out for anybody that works for them.
Right. Number one, how old is your son, if you don't mind me asking? Not a personal question.
39.
Okay, so then, he can no longer be covered under your plan.
That's correct.
So, if his employer offers insurance, then that's fine. I mean, it all depends on the employer. But if they don't, then, more than likely, he'll be able to purchase insurance through the individual exchange. And if he is making, that amount, like within that line,
Right.
chances are there's already going to be tax credits there that's going to reduce his premium rates.
Okay.
So he might be able to benefit the most from the individual exchange.
One last odd question is, for those of us who are on Medicare, will this system have an interesting benefit to seniors who are on Medicare when it comes to their medications and their co-pays and things like that? Because obviously, as the system becomes more open and transparent, and the rates become more identifiable for all of us, can you speak to that?
Yes, on Medicare, you're unaffected. You'll stay on Medicare,
Of course, yeah.
and your supplemental will be what you purchase now for a supplemental policy. But the changes in Medicare are that the donut hole, where if you pay for drugs to a certain level, then you have to pay for it all until you get to the other side of this donut hole.
the full
that will
coverage,
be closed up. It'll be a period of time, but it will be closed up, so you will have a 80%, 20% requirement under whichever insurance you buy for your pharmaceutical coverage, but you will not be required to pay 100% of the costs. I would have liked to have seen stronger provisions with the government being able to negotiate with pharmaceutical manufacturers to get lower prices. We haven't been successful there. The pharmaceutical industry is too powerful, and we didn't get those concessions, but the donut hole will be filled up. The other change in Medicare that's going to be, I think, very, very valuable, and it's valuable for everybody, all insurance policies will have to provide preventive care without co-payments.
Good.
And this is in order to keep people from getting diseases that we'd have to otherwise pay to cure. So whether you're an employer insurance policy, an individual insurance policy, or Medicare, which is a public program, your prevention aspects will be paid for 100% by the program. In Medicare, the trust fund has been made more viable, is made viable for a longer period of time. One of the changes in Medicare was to pay for Medicare Advantage policies less than what they had been paid. As an aside, I wrote the law to allow managed care plans to be available for Medicare beneficiaries to choose, but then the question was, what does the government pay in a per capita amount? And we said that since so many of the HMOs or managed care plans were less than the fee-for-service, we'd pay them 80% or 90%. Well, in order to make people try to move into those plans, we were paying them 120%. And the Congress said, no, that's just overpaying them, and that doesn't make sense. So they have gotten a reduction in the amount of their payment, but that hasn't affected their rates. Their rates, in fact, have dropped for the Medicare Advantage. But you'll have Medicare Advantage plans, you'll have fee-for-service Medicare, the same as it is now, and as a result of some of the savings that we're not paying for that higher-priced insurance or overpaying for it, the Medicare Trust Fund is extended for another 10, 15 years.
One last question, and it's for the Congressman. The current status of the chained CPI, or Consumer Price Index, links to increase essentially the cost of Medicare to those who are on the system. What's the current status, and what are your views on how we should deal with that?
They're two separate things. Medicare beneficiaries have to pay a Part B premium, and if they want, this is all voluntary, but nobody will go without it because it's such essential services are covered under Part B, and it's a good deal.
Right.
The Part B premium will be increased based on earnings, and people who have a larger amount of earnings will pay a higher Part B than those who have lower earnings. That Part B premium will be affected in that way. That is not based on a COLA, it's based on the overall program costs for Part B services. The CPI, what's the term? The
Chain CPI?
Chain CPI is another way of evaluating the cost of living increases for Social Security.
Right.
Different program. And we've already made a policy decision in this country. We're not going to keep Social Security at a certain level and that's it. We would reflect the cost of living increases. The chain CPI is a way of calculating the cost of living that will reduce the amount. And some economists argue it's better because it reflects a more honest marketplace. All I know is that people who are seniors shouldn't be considered as part of the CPI for the chain CPI because they have higher medical costs no matter what. And so I'm against changing the CPI under Social Security. I think we ought to leave it alone. It wouldn't affect anybody the first year. The second year, it's a small amount. But it means eventually you will be further and further behind in keeping up with inflation under Social Security. So Social Security is the chain CPI issue. The Medicare Part B premium is based on the overall program costs.
Yeah. Thanks for the explanation.
Sure.
And thanks for being here.
Yeah, thank you, Dennis.
Just a couple of quick. Is there going to be, my name is Rick Andrade from the SCORE, volunteer for SCORE. And some of the businesses are thinking, is there going to be an announcement or a one-page or a one-sheet or something that announces that this is what's going to happen to small businesses, this is what you have to do, and this is what you don't have to do, and this is what's going to happen if you don't do it?
Okay, so,
In other words, you have, up here you have Covered California, you have a lot of websites, but my guys are going, well,
Right.
who's going to tell me what
right,
to do?
yeah, and like, what's going on here?
What's going on
Right?
here?
What's going on?
Because we're having these meetings, and they're going, okay,
Right.
well, Rick's going to come
Everybody's
tell us
talking
what's
about
going
it.
on.
Right, so this is actually something that's happening, and if I had a timeline here from Covered California, then I would show it to you, but everything's happening so fast, obviously. October 1st is going to be when open enrollment starts, and they're anticipating somewhere by July, August, and September, they're going to be really doing, like, focusing on outreach and marketing efforts, like, a lot. TV, media, paid media, earned media, newspaper, print, like, you name it. And so they're going to go, all out and do this. They're still putting together the materials like the little one-pagers. We got a little glimpse of them, and we were able to give our, 2 cents on, no, make the logo bigger or make the logo smaller. Not like that, though. But yeah, no, they're still coming out with this material. So I would say that by the end of June or even mid-July, there'll be real good, concrete information that you can really look at and really know like what this thing is going to look like. But fail-safe, October is when the doors are going to open. But, it's unfortunate that we already don't have information
Well, a
now,
lot of
but-
what you went through today has information that is very specific, and can they go to a website to
Right,
access
that's what I wanted.
that?
Should we go to the SBA? Should we go to your organization? Should we go to Covered California? Where do we
So,
start?
okay, well, it depends on what. So this is it's the health plans and rates for 2014.
No, hold on a second. That's 80 pages. These guys want something very simple, very straightforward.
Do they
just-
cover, what do they cover, what do they
What
have
do
an
they cover? What do I
obligation?
do? I've already got to go back to work already, so what do I do? I don't want to
Set
read
up a
80 pages.
presentation like this.
Pardon me?
Set up a presentation like this and
No, I'm just trying
allow.
to tell them, should they go to this one place to begin the process? The starting line of the marathon is where?
Do you have, is there something that they can access to know what the rules are going to be for small businesses?
There's some.
That says 50 employees or more,
Yes.
50 employees or less, what you can do, what you don't have to. You're in the very, very specific, how much it's going to cost.
In the
You want
weeds,
to know,
so to speak, yeah.
you're dealing with employers who want to know, I don't want to know what the cost is, do I have to do anything?
Right, and if I don't
Okay.
do anything,
Yeah.
Right. Okay, so there's some information right there on that little table. So there's what's in it for small businesses, and then there's a report that says just the facts. Really is a really good little newspaper thing that you can look at. Very easy to read on what the facts are. And if you give me your information, I'll email you more. I'll email you links to all the one-pagers that you want, and whichever one looks good, like it really fits the description for your business, I'm sure we can find one. So if you can reach out to me, that would be great.
and who's going to manage the penalties when there is a penalty? You said the IRS was going to send a letter saying somebody was pinged and you're not following the procedures, so expect to have more information from us about what you're doing right and wrong?
Right, the IRS will be the enforcing entity. I don't know what that's gonna look like, if it's gonna be a letter, a phone call, or an email. I mean, I don't know how that's
So we're
gonna look.
expecting the IRS to ramp up to be able to do this, my assumption.
They are making their information online-based, web-based, so that it can communicate now, essentially, with every state and, work with every web portal that's out there.
Well,
So-
speaking of that then, Congressman, wasn't there, correct me if I'm wrong, going to be, or is there an argument about cross-border competition between healthcare companies that would lower the costs here in California? Where is that?
Yeah, that was an idea that had been put out as a way to hold down healthcare costs. It's not part of this law. The problem with it is you were not comparing apples to apples. If the state of Tennessee offered a healthcare policy that didn't cover everything and it was cheaper, people said, well, why can't I just buy that in California? But the insurance commissioner in California wouldn't approve that for the people, for consumer protections. So it wasn't, and it would also drive everything down because that's cheaper. Then people say, I want to buy something cheaper. So you'd have a scaled down policy. The premise of this law is that everybody will get a certain set of benefits that should be in an insurance policy. Many people have bought cancer-only protection policies because that's what they fear the most. And they have some other problem or accident, and they find, oh no, your policy doesn't cover that. A quick summary: if you're an employer and you cover your employees now, that's it. You're not going to be affected. If you're a small business of less than 50, correct me if I'm wrong, employees, you don't have to do anything. You may want to cover them, and you may get some tax breaks to do that, but you have no obligation to do anything. If you have more than 50 full-time employees, you have some obligations, and then there are questions of how do you meet those obligations. The idea of the exchange was primarily for individuals to buy an individual policy and to give them access to a group rate. Employers have in the past been able and will continue to get a group rate. If you go to work for an employer, most employers cover everybody, and there isn't that discrimination in an individual that may get sick and everybody's policies go up. But there are those instances for the smaller groups. So we're trying to equalize things. I don't know what to, I have a Q&A thing. I don't know where I got it, but can we get him a copy of what I just have? And I think there are other things available. You'll have a lot of information to figure out what you need to do.
Last comment, last question
Yeah.
for you. What is the probability that in some period of time, this whole thing could be revoked?
The House of
And
Representatives.
what is your basis for building on that argument?
Okay. In the House of Representatives last week, for the 37th time, the majority in the House voted to repeal the whole law. That is because the Republicans who have the majority are so strongly against this that they want to just say, we're against it, we're against it, we're against it. The fact of the matter is that the law passed, the court upheld it, the election reaffirmed the presidency of Barack Obama, and we're now getting to the implementation part of it. So it's going to be implemented. It's going to be put in effect. Ordinarily, when any big law has been passed, there's a law that follows it called a corrections legislation. Because there are a lot of things that people didn't expect, didn't realize, and they want to correct it. We cannot get any corrections legislation passed. The Republicans don't want to correct anything. They hope it will fail. Now, a lot of it's already in effect. Right now, in effect, is insurance companies have to spend 80% of the premium dollars on health care, and they can have no more than 20% for their overhead. That is a change, and a lot of insurance companies are realizing that they have collected too much for overhead, and they're refunding, Goodwill and others, refunding money. That's in effect. Kids can stay on their policy up to age 26. That's already in effect. What's already in effect is a lot of the small business tax credits. Are they in effect already? The Medicare areas are already in effect. The thing that is not in effect, which will start in January, is the exchange for individuals to buy insurance policies or small employers to go and shop for an insurance policy. And that's what is yet to happen. And we're going to, I hope this goes smoothly. This is so much bigger than, let's say, the pharmaceutical benefit that was added to Medicare, which I didn't think was the best way to handle that issue, but I wasn't in the majority adopted it, and people now have to shop for a separate policy. I thought it should have just been a benefit under Medicare, but people in Medicare have to shop for a separate policy to get coverage unless they're in a managed care plan which covers it. So that even took a little adjustment, and there was some confusion and questions about it. There will be a lot of questions and some confusion about this law.
Well, is there any leading change that you're proposing that is not being put into effect due to the obstruction to this Affordable Care Act? In other words, is there some hanging thing out there that should be fixed, or we're only going to know about it when it's implemented?
Well, there are things we're going to find out about. But for me, I always thought we should have done more to pay for this by negotiating with pharmaceutical prices. Medicaid, we call it Medi-Cal in California, is required to give a rebate because these are the very, very poor people.
Yeah.
And they were required to give a rebate to the government when Medicaid or Medi-Cal bought the drugs for their covered people. Well, when the Republicans adopted the pharmaceutical benefit, they said, oh, we're not going to have coverage under Medicaid. They're all going to be under Medicare. So the same people who are eligible for Medi-Cal and Medicare, we're talking about elderly people who are very poor. We're paying a lot more for their drugs. Why? Same people, same drugs. Why are we paying more? I would like to change that. There are other things I would have liked to have had one of the options, a public policy option that people can then choose as one of their options. We didn't get that. But no, it is what it is. It's what was possible to pass only with Democratic votes. All Democrats are not of like-mindedness. We had the Senate, a requirement for 60 votes. A senator from Nebraska held up the bill because he wanted something Nebraska-specific. Well, that passed in the Senate bill, then we corrected it in the follow-up bill in adopting the whole legislation. We're going to learn that there's things that need to be corrected. There's no question about it, and I hope we'll be able to change the legislation. It is not going to be repealed. It's going to go into effect, and I think by and large people are going to be reasonably happy about it, especially people who couldn't buy insurance at all because of pre-existing medical conditions. I think that individuals will see that they can afford it because of the tax credits that will be available to them. I hope it's not going to be a burden on businesses, but since most businesses already cover their employees, that's not going to change. And we'll have a lot to deal with the small businesses, but we're talking about only a slice of small businesses that will have to do anything different and have
Thank
any
you.
requirement on them.
Thank you all for coming. Thank you.
Yeah, thank you all. Final word?
No
From
more
our chamber?
questions? Okay, thank you, Congressman Waxman, Natalie Orta, and Marcia Davalos. And we look forward to seeing Congressman Waxman tomorrow at our luncheon.
Tomorrow?
Okay, thank you very
Looking
much.
forward to it. Thank you. We stand adjourned.
Nice. You were waiting for that, weren't you?